is Ayesha Akhtar with the Epilepsy Foundation of Greater Chicago. Today we are going to talk about medication management as it relates to epilepsy, which is a common chronic disease. It's actually the fourth most common chronic disease, and so that means it's expensive. Today I wanted to have Dr. Mitra Habibi join me and talk a little bit about medication. She is a clinical assistant professor at the College of Pharmacy at UIC. So Dr. Habibi, thank you for being with me.
Thank you so much for having me.
So what I wanted to kind of just start with an overall medication management. What would you recommend for your patients living with epilepsy, knowing this is a chronic disorder? How do you recommend patients, manage their medication? Like how many days out should they have prescription? What are your recommendations?
Medication is the main tool that we have in management of epilepsy to minimize the risk of seizures, to minimize breakthrough seizures, and basically controlling epilepsy. So it's very important and crucial that the medications are taken as prescribed, the number of times that are supposed to be taken during the day. There's a reason that some medications are sort of prescribed as twice a day, some once a day, some 3 times a day. So it's very important that the medications are taken as prescribed. It has to do with how the medications work, and we typically, when we have a conversation with our patients and start them on a new medication, talk to them about this. And it's very important that these medications are not abruptly discontinued because of the nature of the disease. Patients basically put themselves at really risk. We see that sometimes when patients do that, unfortunately, they may end up in our emergency room with having multiple seizures. They will notice that when they are started on a medication, the physicians or pharmacists who are working with them, they may give them a titration schedule to go slowly up, and when they're taking the medication off, they give them a schedule to slowly go down. There is a reason for that. It's really not recommended. It's really dangerous to stop this medication abruptly. My advice would be that if something happens and there is a reason that they don't tolerate the medication, where they don't like the way they feel on the medication for any reason, that they always call their neurologist and have a conversation with the neurologist before touching this medication or taking it. That will be the safest way to do it. As far as taking these medications, obviously compliance is a major issue. Sometimes patients come in, and when I notice that they have had more seizures in a month, or seizures were controlled for a long time, and all of a sudden they had what we call a breakthrough seizures, we noticed that some doses of medications were missed. So we always talk about how important it is. And we always tell them, if you miss a dose, as soon as you remember, you should take it. And never allow to run out of your prescriptions. Always pay attention to what it is on the bottle. There's the number of refills that you are allowed. It's on the bottle, or you can ask your pharmacist. And make sure that even if you haven't had a chance to visit the clinic, you have missed an appointment, and you shouldn't run out of your prescription, you can always call, because it happens. Sometimes patients come in and said, I had 2 seizures. What happened? Oh, I ran out of my prescription a month ago. Well, you should have called. They would have renewed your prescription. So make sure you don't run out of the medication. So these are some of the tips that usually we review with our patients.
I think that it's really important to have literacy in medication management and prescription, like understanding what RX means, what twice a day means, what 3 times a day means. I think those things are really important. They're all written in shorthand on the bottle. How would you recommend? Because also what I've heard is people splitting pills, thinking that they're outsmarting the actual prescription and extending the life. But maybe you could talk a little bit about the half-life of anti-seizure medications and why splitting a pill is actually doing more harm than good.
Well, for some formulations, when it says on the bottle that is extended release formulation, it just basically, if you cut it in half, you are, in simple form, ruining that extended release formulation. You're disrupting it. It won't work that way. And the frequency of how many times a physician prescribes that has to do with what formulation they're using. So the pharmacist in the pharmacy will tell you the same thing. You should never cut a medication that it says is extended release formulation. It will basically ruins that formulation type. Some of our medications have longer half-life, which means it stays in the body longer. And some medications have shorter half-life. It means that your body will get rid of it much faster. So when it comes to missing doses, the medications that are shorter acting, shorter half-life, they are less forgiving, Many times we see, I will give you an example, for example, a very popular medication, Keppra or levetiracetam, very popular. Many patients are on it, but it's a short-acting medication and very unforgiving when a miss of medication is missed. Many times we see that the patients have had breakthrough seizures because one or two doses of that medication was missed. Because it's so short-acting, as soon as a dose is missed, majority of that medication is already excreted, gone from the body. So half-life, and some medications are less problematic, but again, those are the medication that the physician is prescribing once a day. So again, it means that you should take it once a day. It lasts longer, but it obviously doesn't last for forever. So it's very important. Sometimes I use an example when our patients ask me that question, that is like eating breakfast and saying, well, I don't need lunch and I don't need dinner. Obviously it's not gonna, it's the same thing. You take it in the morning, you miss the other parts of the medication, and during the day, you put yourself at risk of having breakthrough seizures. So it's very important that you read the bottle and follow the instructions on the bottle. So when we initially start any of our patients on a medication, depending on what medication is, so your neurologist, if there's a pharmacist, there's a nurse who are working with a neurologist that are educating the patient on titration schedule. Basically, depending on what medication is, we have to go with some medication, we can go up faster, and with some medication, we have to go up slower, which has to do, we are trying to sort of prevent some adverse effects or risk associated with those medications. One of the major side effects of, for example, this medication is that patients can experience tiredness, sleepiness in the beginning. So you will notice that the physician is giving you a little bit of medication at a time, depending on what medication he's using. So you will notice the medication says to start this medication at this dose and increase by this much on a weekly basis till you get to a target amount. And while you're going up that titration schedule, going slowly up on a dose of medication, he's trying to sort of help your body tolerate this medication better till he gets or she gets to a target dose. That's the purpose of doing a titration schedule, basically increasing the dose of medication, helping you to tolerate this new medication better and minimizing the risk of side effects with that medication. So we do recommend to our patients that take the medication dose as soon as you remember. With these medications, the reason is that when you miss a dose, as we just talked about, the amount of medication that is in your blood and controls, prevents seizures is going to drop. So as soon as we say you remember, take this medication because it's going to help to bring this amount, this level back up. So what will happen if your next dose is a close dose that is closer? What will happen is that, is it possible that the patient or you may have some sleepiness, a little bit of fatigue, a little tiredness because you're taking two doses together? Yes, that's a possibility. But that possibility is better than being at risk of having a breakthrough seizure. So we always prepare our patients, do this, take it as soon as you remember. That is the risk, yes, it may be because you're taking the medication so closer together, that yeah, you may be a little bit more tired than usual, but that's again, it will bring up the level that has dropped because you forgot to take medication, but it's better than putting yourself at risk of having a breakthrough seizure.
Drug interactions. What are the most common things that you've seen, or what advice would you give to patients?
So our class of medications, actually in medicine, they are known, very well known for causing drug-drug interactions. Our medications interact with each other. They interact with a lot of drugs that are out there, interact with over-the-counter medications, and vice versa. So too many actually to name, but what we do, that's why we pay very close attention to what medications we're combining together and what they do to each other. We pay very close attention to that. What advice that I always give our patient, for example, the patient comes and sees us and we start them on a new anti-seizure medication, and the patient may have other chronic issues, or all of a sudden experience migraine headaches, have high blood pressure, have diabetes, or other chronic issues that they get prescription for. My biggest advice to our patient is that always tell the other physician what medications you're on. We routinely, ask them or help them to have a list of their medications with them when they go and see a different physician. That they know that they're taking one of our medications, or we know that they're taking another medication. We always ask our patient, we always check their pharmacy history. One thing that will be missed is over-the-counter medications, because when I check the patient's prescription list from their pharmacy, it will tell me what prescription medication they're taking, so it will help me avoid drug-drug interactions. But I will not know. I have to ask the patient and rely on that what over-the-counter medication they're taking, airborne medication they're taking. So our education would be, tell your physician when you go and see them that if you are starting a new medication, or another physician is starting a new medication. That's the best way that we have to make sure that we're minimizing unwanted drug-drug interactions.
And you actually just reminded me of another very common concern in the world of anti-seizure medications, which is brand versus generic. And I know that there are so many complicating situations there. Could you comment on that briefly?
So brand medications, eventually all of them transition to generic medications, and we use generic medications all the time. As a person who works in this field, I'm grateful that actually we have generic medication. And this is the reason: it brings down the cost of these medications. Medications are very, very costly, and it helps us to prescribe a medication that is brand too expensive, can get approved, to offer it to patients because generic form is available. What helps us to sort of manage some of the differences that they have is that we monitor the patient, and we monitor the patient blood levels, and we make sure that the patient with this generic medication is at the correct level that they need to be to correct their, to sort of prevent their seizures. One thing that is important with generic medications, and we do see, for example, if the patient stays on the same generic form, that's not the issue. Obviously, we see very little issue if the patient continues taking the same brand of generic medication over and over. Sometimes we see that issues come up because every time they go to the pharmacy has a different brand of different manufacturer of these generic medications, and patients notice it. They come and says, my pill looked like this a month ago and now looks like this month. So that may cause some variability in this, and it's very hard to control that. Patient can ask the pharmacy, but pharmacies purchase medications from so many different manufacturers. But again, how we manage it in epilepsy, as I said, we have many patients on generic medications. How we manage it is that we make sure that we check blood levels and make sure that the patient is on the level that they need to be for seizure to be controlled. Again, if it weren't for generic medications, we would have much more significant problems getting these medications approved. Generic medications is what brings down the cost of these medications significantly down, so we use it all the time.
I want to thank you for spending some time with me today, and I look forward to doing more education with you. Is there anything else that you would like to share, or anything else that we haven't talked about that you think is a very important message?
I think most of the important things that the initial important things that it's very crucial to keep the seizure under control, we have talked about. In my field, constantly talking to patients about sort of being compliant, getting educated. We have a lot of women who are of childbearing age. If you want to discuss that at another time, we can discuss that. Sometimes we get phone calls from our patients and panicking and all of a sudden stopping their medications because they found out that sort of they're pregnant. My advice is always call the office, call the clinic, call the neurologist before you make any actions by yourself on your medication. Is always to discuss it. Those are the ones who really are experts in these medications. Have a discussion with them before stopping your medication. So that will be the biggest advice that I would have. Always be in contact. And the other thing that I will talk about, one of the things that we have noticed is that we talk in the clinic with our patients about this new medication that we're starting or the changes that we're making. For example, we have to decrease the dose or we have to increase the dose. And one of the things that sometimes I notice is that patients go home, and if I call them back, I realize that sort of there was this gap in understanding of what happened in this visit. And while we were in the room, patient didn't ask us and didn't sort of bring us up that I didn't understand this part of it. So my other advice to patients is that please don't leave that room, that clinic, unless you're 100% sure that you understood what the instructions were. If you run into trouble, they're giving you verbal, they're just telling you, and you need them to write it down for you. We provide it all the time. To ask for it, says, can you write this down for me? I happened that happening too many times. I said, oh my gosh, this was missed. We did discuss it, but it was missed. So you're not sure about something that someone told you. Sometimes, you're used to using medical terms and we said something that it wasn't clear. Please ask, make sure that you understand what the changes are before you leave the example.
Right. That cannot be stressed enough. It's just, that goes back to one of the tenets at the Epilepsy Foundation of Greater Chicago, where we want to coach our clients to become the best self-advocates and not leave that room until they understand all the instructions and even write it in their own shorthand. And then maybe, the epileptologist or their neurologist can actually read what they've written just to make sure that it is a correct assumption, understanding of what the instructions were. So I definitely agree with that. So there's a lot more work for us to do in this space, and I look forward to doing that with you. So thank you again for your time today.
My pleasure. Thank you so much for having me.
Bye-bye.